and welcome to Embracing the Fight. I am Erica Lamar, your digital creator and host. And if you've been with me since January of 2023, you will know that Embracing the Fight is about normalizing the conversation surrounding physical and mental health issues and concerns. And if you have, I hope that you have subscribed to my YouTube channel, Embracing the Fight, and that you check me out on X, Facebook, Instagram, and Snapchat. Have you? I sure hope you have. I would appreciate it greatly if you would take my message and share it with your family and friends, because we all know that taking care of ourselves is one of the most important things that we can do that will give us better quality of life. So today's episode is episode 59, Healthcare and Politics. So why is it that when people talk about politics, they tend to get angry, or some people don't want to talk about it at all? I understand, at work, you can start some pretty bad arguments, concerning politics. But when you think about it and you break those things down, the issues are really what folks are fighting over, not necessarily the candidates. Now, the people that's fighting over the candidates, it's because they only know the personalities of the candidates and not, what they stand for really. Because if you try to get into those in-depth conversations with people who are just arguing about the person per se, take a step back and see, what is it that they see in this candidate, or what is it that this person, can do to help improve, the plight of America. So with that being said, think about it. What's one of the most important things when it comes to, an election? Healthcare, right? Everybody's talking about how your deductibles have been going up, how it's so hard to get in to see a doctor, how so many doctors, nurses, other healthcare professionals are like having this mass exodus, since COVID. Because imagine, you're an essential worker and you're in healthcare. So you're watching people, die every day in droves, and you're not getting the proper rest, and you weren't getting paid what you thought you should have gotten paid. So you decided to do something different. So you've taken all of your skills, with healthcare, and you moved on. And the backfill for that has been very, very slow. So I put together a short presentation, to kind of go through with you all so you can kind of see, what healthcare and politics look like together for the upcoming election. Take a look. This is episode 59, Healthcare and Politics. So I just want to give you a little bit of information concerning politics and healthcare, why or what's important to you, and what healthcare is going to look like on the horizon. So let's talk about voting first. A lot of people think, that their votes don't count. Well, sure, you have your electoral college where there are a certain amount of votes that are given to each state that have an impact on the presidential election. Of course, we vote and we are considered, the popular vote, but then there's the electoral college that ultimately makes the decision. But you have to think of it like this: that electoral college normally goes along with the popular vote. Now, I don't know what metrics they use to make them decide, why certain states have so many more votes. I'm sure it has something to do, with the population and the amount of people per capita. But then when you think of those states that don't have very many people, but they have a whole lot of electoral college votes, it's like, are they evening it out because, the population isn't that great there, but their voice needs to be heard. So you really need to consider that fact, that if the popular vote is swinging one way, the electoral college should also swing that way as well. But like I said, I'm not a politically acclaimed person, but I do know enough to be dangerous. All right, so 2024 elections, I really want you guys to look at this chart. because it's telling you when the primaries are and when the special elections, any propositions, and when you actually have to vote in order for it to count. But before you can even do that, are you registered to vote? So what's the point of knowing, that you can vote, but you don't vote because you haven't registered? Or you think you don't have the ability to register? There are people out there that have felonies that believe they can't vote. You can vote. You have to go through a special process to actually get this back. And that's something that, I would suggest that you do. If you have a felony and you would like to vote, you should go to a government office and speak with them and say, hey, what is it that I need to do to gain back my right to vote? Or do like we do, Google. Ask Google, what you have to do in order to get your right back to vote. Don't just sit there and say, oh, I can't vote because I have a felony, or can't vote because I'm away at school, or I can't vote because I've never registered to vote. Don't let those be your reasons as to why you don't want your voice to be heard. Do what you have to do in order to vote. So there's still time to register to vote, because each state has its own cutoff. And if you go to the state websites, they'll tell you what the cutoffs are. Or you can go to the link that I have below, which is basically usa.gov/register to vote. And you can see there what the state's deadlines are. And you can go to each state website and see, how you can register, whether you want to register by mail. You can go to the post office. They have those little postcards that you can get and you can complete the information. Or you can go to your license commissioner's office, same place you go for fishing permits, gun permits, things of that nature. You can also get your voter's registration completed there. So no excuses. If you want to vote, there's still time to register to vote. Do what you have to do to get there. Please don't wait too long, though, because each state, like I said, has its own individual deadline. Florida is quite different from Georgia, and they're both very different from Texas. So make sure that you go on this website and you find out when is the last time or date that you can register to vote. All right, so election 2024, when we talk about things that are extremely important to people when it comes to healthcare, one of the things that they mentioned, there's a organization called KFS that completed a poll of various individuals that vote and said, okay, what's most important to you when it comes to healthcare or when it comes to voting in this election? And one of the things that came up was the Affordable Health Care Act of 2010, and people often refer to it as Obamacare. They talk about the abortion rights, because if 50 years ago, Roe versus Wade basically gave you the right to have an abortion and not allow the state or any federal government to give you any criminal charges for having an abortion. Mainly, this wasn't for, say, people who just wanted to have an abortion just because, but this is basically protecting, the rights of individuals, especially those who had medical issues or late-term pregnancy issues. I'm not judging anyone. These are just things, that I've read. And it basically was protecting, the rights of the pregnant woman, in a sense. And it was overturned by the Dobbs versus Jackson's Women's Health Organization. And I'll talk a little bit more about that shortly. Also, if you notice that while COVID was going on, Medicaid continuous enrollment and prescription drugs provisions were made to be continuous. And that meant, if you were on Medicaid, you were there. Nobody's going to take you off for any reason. The government was making sure that while COVID was going on, that you were taken care of, your health was taken care of, and you weren't just left out there to fend for yourself, because there were a lot of people that were losing, well, I wouldn't say they were losing their jobs, but they weren't making any money because certain jobs closed. And when they reopened, sure, those people probably went back to what they were doing. But what about the time, when they weren't able to afford healthcare? Then they could go and they could get Medicaid and take care of themselves and their children. All right. And then you have to think about the access to mental health care. What are our candidates doing, about the opioid crisis? So if you look at the chart here, it's basically letting you know that inflation, including the rising cost of household expenses, is like number one. People are really concerned with that. Because if you think about it, as inflation increases, what do you think, healthcare costs do? They go up as well. And how do you pay for healthcare if you can't afford your, normal everyday bills, right? And then next, they said that affordability of healthcare, was number two, the future of Medicare and Medicaid, and then access to mental health care. So we're just going to go through those in the next few slides. All right. So what do you know about the Affordable Health Care Act of 2010, excuse me? So it's often been referred to as ACA or PPACA or Obamacare. So it has three main goals. And all of it has to do with where the federal poverty level is. So you want to make affordable healthcare insurance available to more people. So you have those people that had SSI, people who were unemployed, or people who were, say, just generally homeless, but not necessarily living on the street. Say they were homeless in the sense that they don't own a home, but they live with someone else, but they don't have a job, and they don't, have access to healthcare. This actually lowers the cost for households with people who were between 100% and 400% of that federal poverty level. So if it was above it, you would still qualify for a premium tax credit. Now, you might not get as good of a deal when it comes to the Affordable Health Care Act if you are gainfully employed, you have insurance, through your company. But with all things comes a price. Think of it this way. Would you rather be able to choose and select where you'd like to go, to have your health care, or do you want to have I wouldn't say bare minimum, but would you just like to have the ability to be seen for a particular illness? So I'm more on the stance of I would like to have a choice. And sometimes, choices and convenience cost you a little bit more money. But at the same time, you hear people saying, oh, we have to pay so much more because of the Affordable Health Care Act. But low income folks, in my opinion, need assistance as well, especially if you think about, the elderly. We have over 70 million baby boomers that are alive and well, that may have had pensions, that may have Social Security, but with inflation being the way that it is, how are they to actually afford health care if they weren't given a little bit of help? So you have to support, innovative medical care methods for healthcare in general, if you are thinking about the betterment, of mankind, if you're thinking about, helping others. But the question is, the person that you are looking to elect, what is their stance on affordable healthcare? Do they believe that all people should get out and get their own healthcare, even those that, are disabled or mentally incapacitated? I mean, what do you want them to do? And I know you have some folks out there that say, if I made it, they can make it too, but every person's situation, circumstance is different. All right, so let's talk about the abortion rights after the Dobbs decision. So if y'all know, Roe versus Wade was back in January of 1973, and it was a landmark decision where the U.S. Supreme Court basically said, that the Constitution protected the right to have an abortion in the sense that, we have the right to privacy. Because basically what it says in the first section of Amendment 14 that points to this is that no state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law, nor deny to any person within its jurisdiction the equal protection of laws. So they took that to mean that if this person was wishing to have an abortion because it was going to impact their life, like for instance where it says deprive any person of life, if you're a woman and you're in late term pregnancy and you start to have complications and the doctor then comes to you and says, hey, it's either you or the baby and you have to make a decision. Now, I'm not saying the person is right or wrong for whatever decision they make. I'm just saying this person has to make a decision. And with Roe versus Wade, it protects the person from any criminal charges from the decision that if they're protecting themselves by not having a baby, but by having an abortion, then they were using it to protect their rights, to protect themselves. Or you also have to think about those women who were sexually assaulted, raped, things of that nature, and a child was produced in the process. Well, with that, it's another thing that you have to really think about, because you're having, if you decide to have this child, you are looking at the product of a heinous crime that was done to you. And a lot of people can't handle that. Some people can look at it and say, every child's a blessing, take the child, love it, have it to grow up to be a viable citizen, while others, in that same, frame of mind, they might want to give the child away. But then when you do that, you put another child, into the system. So there's a lot of things that those people, have to think about when they go through that. And Roe versus Wade basically protected that right. Well, Dobbs versus Jackson, Women's Health Organization, in June of 2022, almost 50 years later, they basically came back and said that the Constitution does not confer a right to an abortion, especially like those late term abortions. So why are we even talking about this when it comes to election? Okay. There are three major branches to the government, and one of them is the judicial branch where the U.S. Supreme Court is housed. Well, when we talk about the U.S. Supreme Court, how do you become, a Supreme Court justice or a judge? You are nominated by the President of the United States. So whoever you vote for president, in turn gets to select who's on the Supreme Court. And those people stay there until either they are impeached, they die, or they become incapacitated by an illness. So imagine you have someone that's sitting on the Supreme Court for 25 years whose beliefs don't match yours, and they're constantly making decisions that are detrimental to your health and to your life. So that's something you really need to think about. Whoever you're electing as president has the ability to put someone in place that's going to impact your rights, especially when it comes to healthcare or when it comes to something like abortion. So then there's this unwinding of the Medicaid continuous enrollment and prescription drug provision. Sure, when I said it, I was like, unwinding, what does that even mean? So you all know that the continuous requirement for medical health coverage was required during COVID-19. So between 8 and 24 million people could lose Medicaid coverage during the unwinding process. And basically, what unwinding means is that Medicaid is now going to resume their eligibility reviews, and they've already started, in some states. Some states, haven't started doing it just yet. And all they do is they come in and they look at each individual's situation. They look at, what their wages are, whether they have developed something that is not allowing them to work anymore, if their situation has changed. Say, for instance, if you were on Medicaid because you had, lots of children that you were taking care of, but not all your kids are wrong, they may look at that and say, your kids are out, you don't need Medicaid anymore, it's just you. So it's up to those agencies to unwind and take everybody off that they think that don't meet the requirements. So then once you're off, then you have to go back and try to get recertified and get Medicaid again. So you have those people, say for instance, when you think about, the elderly, if people are sending them notices and say, I don't know, they don't read the mail, or they're blind, or they have, trouble reading or things like that, if that document goes, unnoticed and isn't returned, they can lose Medicaid and not even know it. So that's one of the downfalls of the unwinding process. So then it's going to take time, once, say for instance, the person finds out when they go to the doctor for something that they no longer have coverage. So at that point, they then have to start over, the Medicaid process in order to become eligible again. So during that time, they have to take care of their own care. Now, if they weren't able to take care of it before, and because of a formality, they can't take care of it now, what do you think is going to happen? They're either going to have to find patient advocate or hospital, some nonprofit or someone, to help them bridge the gap. Otherwise, they're going to be in that 8 million to 24 million people that don't have health care coverage. All right, so let's talk a little bit about access to mental health care. You see all these different photos of people that, on the screen. You have the counselor, you have the guy that is praying for healing. He's praying for his mind to be right. He's just praying. And then you have the folks that work, in the medical field, and you have those group sessions where people are allowed to speak openly and freely and talk about, their issues so they can heal. And then you have that older couple that could potentially be dealing with, dementia, and they're watching, their loved one as they fade away, and they're trying to hold on to that very last piece of that person. Or you could be that young girl that's in a corner that's just now coming into herself as a teenager, and she's really unsure of herself. What happens when mental health care isn't available to you? What happens if that is removed from your healthcare coverage? What will you do? So how does your candidate feel about the importance of mental health care? Does he feel like it's an elective, or is it absolutely necessary? Don't know. Depends on who your candidate is. Have you taken the time to research how they feel about mental health care and what strides they're going to take to help people continue to build their mental health? For instance, every time you turn around, there's a person that is going into an establishment, into a parade, into a school, walking down the street, that's just taking folks' lives because they have a mental health issue that has gone unnoticed, unmedicated, undiagnosed, all because of the access, or should I say lack of access, that we have when it comes to mental health care. Or it may not even be a lack of access to it, it's lack of knowledge, because When you get your health insurance, when you think about it, does anybody really just go and say, okay, what's available, to me for mental health? No. Well, at my job, they have an employee assistance line where you can call in and you can tell them, if you have some issues, you need counseling, things like that, and they'll work that out for you. I don't know what other companies have, but what do people have when they don't work anywhere or they need mental health care? Can they get it? Is it available to them? And what will the government do about that? And then you have this opioid crisis. And everybody knows, what an opioid is. It's basically, painkillers. And there's so many people that have been mixing different drugs with these painkillers, and 130 people are dying every day to these opioid related drug overdoses. So right now, it's a crisis. But what are we doing, as far as the government is concerned, with trying to deal with treating the opioid addiction or having some type of access to these overdose reversal drugs? Because the only organization that I was able to get some information from, and then, as you can see, it's the Health Resources and Services Administration, and it's a government organization. And what it does is it provides grantees with resources, technical assistance, and training to help integrate behavioral health care services into practice settings and communities. So, for instance, the HRSA, they give you the documentation, they give you the information that you need, but are people really using it? What is causing folks to go toward these opioids to take away the pain? What pain? Where is it coming from? Do people in government really care about the opioid crisis? And if they do, what is their stance on it? Have you heard them talk about it? Have you listened to any town halls? Have you gone to their website to see what they stand for and what they believe? If you haven't, take the time to do that. So really, what's important to you? The cost of healthcare. So a lot of people right now, when it comes to the cost of healthcare, they'll keep going to the same doctor or same practice, and they may not, be happy with the care, but this is where I've been going, and this is, what I know, so I'm going to stick with it. But then the cost of healthcare is going up, up, up when you could get better quality somewhere else for a lower price. Also, think about your care rights. So every time you go in there, you're signing the document. It's saying something about, who can see your information. Where is your information going once you completed it? And what exactly are your rights? That should be really important to you when you are going to a doctor, any type of physician. It's very important that you know what your rights are. And also, it's even more important to know what the accessibility of care is. So I'll give you an example. I was trying to go and just have a routine visit. And when I called in October of last year to have a physical, a routine physical, they told me the next opening that they had was in February. So either I chose to wait from October to February, or I found a new doctor. What do you think I did? I found a new doctor because it was more important for me to know, you know, what's going on here. I have been dealing with cancer. I've had issues with hypertension. I've had, a lot of little things going on. And it's like, why wait? Go ahead and find out what these things are in order to keep, working towards correcting it and getting it right. Don't just wait, until something bad happens and then just say, oh, look, this happened because I didn't have accessible care. Yes, you do. You can find another doctor because I'm sure there's some new practice that's opened, that's looking open for new patients that you could go and check out. It doesn't mean you got to put that particular physician down that you had previously. It just means that you might need someone in the interim. And if you do that, make sure you take your information with you from one doctor to the next. That way, your medical history is complete. Okay. So the other thing that you should think about when, what's important to you is, does this candidate that you're looking at electing, do their views align with yours? And if you're sitting there saying, well, I'm a Democrat, I'm a Republican, I'm an independent, I'm all these different things, would you vote a straight party ticket? Or are you going to follow your interests and views? What's more important? The outcome or just a win for the party? What if the party as a whole is causing a detriment to healthcare in the United States? You don't always have to vote a straight ticket. You can go and vote for whoever is aligned with your views and what you believe and what you think should happen to help advance healthcare in the United States, if that's what is most important to you. Don't just, take the ballot and say, straight party ticket, I voted, and go out and then wonder why, oh, every time I turn around, my healthcare bills are skyrocketing. I used to be able to get my blood pressure meds for 65 cents. Now it's $75. Or I was able to get, my blood thinners were free. Now they're $600 for a 30-day supply. Why do you think those things keep happening? It isn't, by coincidence. Inflation has an impact. The impact of supply chain. All these different things, come into play, but it stems from the response of government to the healthcare issues that we face. So if you think about it, let's talk a little bit about healthcare on the horizon. Now, did you know that it was 6,120 hospitals in the United States? And in those hospitals, there are 916,752 total staff beds in all U.S. hospitals. 916,752. But they've had 33,679,935 total admissions in all U.S. hospitals. Who's dealing with all these people? It's your healthcare workers, right? So these people, these 33 million, almost 34 million people are rotating in and out of 6,120 hospitals. That's a lot of people. That's a lot of admissions. That's a lot to have to deal with. So what does that look like? So I was reading an article in Forbes, and it's basically saying that you have labor pains, in a sense, because you're addressing the workforce shortage in healthcare. They're saying that about 6.5 million U.S. healthcare professionals will permanently leave their positions in 2026. No, it's 2024. About 2 years, and we're going to lose 6.5 million U.S. healthcare workers. And only 1.9 are going to come in to replace them. That leaves us with a national shortage of more than 4 million workers. Let that sink in. You think it's taking a long time now to get into an emergency room or to be seen by a doctor. What do you think is going to happen in 2026? And what is the government doing to help, backfill these positions? Are they creating programs to entice more people to go in the medical field? Are they giving, student loan forgiveness? for people who go into medicine because they have hundreds and thousands of dollars of debt when they get out of medical school. So what are we doing, to entice people to go that way? Not just anybody now. Don't get me wrong. You want the right person, the person that wants to go to medical school. But how are we getting to those people if only 1.9 million are going to step in and replace the 6.5? So then the next one was margin matters, creating healthier bottom lines. So this mainly has to do with price inflation and labor expenses. And this is compromising the health system's finances and impeding their ability to service debts of $12 billion in impaired municipal bonds. This is the most that they've ever experienced. Well, not ever, in the past 15 years. It's astronomical. We have to do something to help the hospitals create a healthier bottom line. What are we doing to service these debts? The next one is care decisions, AI enablement to improve quality and advance automation. So 2024 is supposed to be like the year of artificial intelligence, so they can automate processes and improve, total outcomes. Like for instance, for sepsis care, they talked about how AI was able to basically come up with a faster way to get to the level of treatment that needed to be done through a clinical decision support system. So they're asking all these questions, and the AI is coming up with whatever the treatment should be based off of the basic fundamentals that have been fed to the AI system for it to critically think, or for it to decide, what path of treatment it should follow based off of what the person has told them, is wrong with them. So then you have the freights of wrath, building supply chain resiliency. Think about it. When COVID was going on, you had people fighting over masks. They were fighting over like Tylenol, Lysol, all these different, things, because we had so many shortages within the supply chain. And then with so many companies closing doors and so many people that, are interconnected, or groups interconnected in those supply chains, you couldn't get what you needed in order to, make it available, make it affordable, and have it, just for people in a sense, and not just these businesses. So we want to be able to create greater diversity of supply sources and get more upstream data on the prices and availability, not just, we about to run out, or, oh my goodness, what are we gonna do? No, there has to be a plan or something in place that helps our supply chain be a little bit more resilient when it comes to healthcare and healthcare supplies. And then this is like the elephant in the room when we talk about dystopian disparities, closing gaps to ensure health equity. And this is basically saying that people of color or minorities don't get the same health care as that of their white counterparts. So you find that more African Americans or more Hispanics are having strokes. They're having more issues with kidney failures and things like that. And when they do, they're not as quick to get a donor to, give you another kidney if you need another kidney to survive. When on the other hand, when our white counterparts have these issues, the kidneys are a little bit more readily available. The healthcare is a little bit more fine-tuned. And it appears to us that this is now something that is coming closer to our soon-to-be elected officials, because they understand that even though we're all human beings, our genetic makeup makes Medicare medical care not be cookie cutter. You can't treat my hypertension the same way that you would treat hypertension with someone who is not African American. For instance, I found that I need a diuretic, to help the fluid to move through my system. But before, my doctor had me on a diuretic and a blood pressure medication, and it was doing the opposite, to my system. So once one portion of it was removed and I was only taking diuretic, my blood pressure has been fine ever since. And this all changed because my initial physician that was doing that, she was not in tune with having African American patients. Now, this is what I was told, and I won't mention her name. But then I had her nurse practitioner to come in, who was African American, that looked at my symptoms, that talked to me a little bit more, took it away, did some tests, and found out all you need is a diuretic. And then she explained a little bit more, saying, well, all you really need to do is lose some weight, drink more water, do these different things, and you shouldn't have any more issues. Not sure why you're on both of these medications. And I haven't had, much of an issue from that point. So there's something that we have to do to close the gap to ensure health equity. Absolutely has to happen. Then you have the healthcare Hunger Games, the race to demonstrate value. So I thought it was interesting that they talk about how consumers are now becoming directly exposed to costs through their health savings accounts and high deductibles, and people are voting with their feet. And when they say they vote with their feet, it means they get the heck out of there. They're not staying there paying, this extremely hot stuff when they could go somewhere else. It's almost like they are consumer driven, where they'll call and say, okay, I need to have a mammogram. How much does it cost to get a mammogram here? Okay. Oh no, that's too high. What about over here? Okay. Theirs is lower than there. What about here? Oh, but if I go through this doctor has something set up through this different radiologist, and I can get it for this. I need to go that way. Because you can take that information from that mammogram and go to whatever physician you want to. So people are starting to move towards quality and price. So that's why they call it the Healthcare Hunger Games. And I thought this was a very interesting read. And if you'd like to read it, it's on Forbes.com. As you can see, the website is listed there. And I'll also have it in the show notes. So I really hope that you take a moment to sit down. I don't know, get your laptop out or get someone who is savvy with a laptop. If you don't like to get on the internet or anything like that, if you want to know about your candidates, please take the time to research the candidates. Don't just do, the mindless thing and just select a party because you've always been a part of a party. Know what the issues are and know how they are going to try to handle them, because you're the person that's going to have to live with whatever decision has been made. And every vote counts. You cannot just let your vote go uncounted because, oh, I don't feel like it. I'm just one vote. Imagine if a million other people felt the same way. You could have voted, and those other people could have voted as well. You could have made a difference. You could have had a major impact on healthcare. So don't sit back. Become an active role, or take an active role and become an active participant in this election, because this all stems from what happened during the pandemic and what's going on with affordable health care. Oh, we got an opioid crisis. Oh, drugs are going out the roof. And oh, we got, Medicaid and dropped a whole bunch of people. How do we fix this? And then, abortions are no longer legal. You got all these different things, that are floating around in the political atmosphere. So what are you going to do in order to take a stand? What are you going to do to show that you really care about what goes on when it comes to healthcare. So I need you to take a moment, go to their website. You can even call, your elected official's office and find out where you can get information on what they believe or what they are supporting when it comes to the things that are most important to us. And something that should be most important to you is your health. And if you're not getting the proper level of health care because of something that an elected official is pushing for and you voted for them because you didn't do your research, shame on you. But if you vote for someone and you stand behind what they say when it comes to healthcare, and it's a win for healthcare and for humankind, then I salute you. Thank you so much for taking a moment out to watch this episode of Embracing the Fight. Please, please, please take a moment out to register to vote. Vote after you have done your research and know who you are voting for. Have an absolute amazing day.